Angina pectoris. When your heart speaks in pain. Imagine a tight band squeezing your chest, or a heavy weight pressing down on it. That's how many describe the pain of angina pectoris, a warning sign from your heart. Angina happens when your heart muscle doesn't get enough oxygen-rich blood. It's like your heart is saying, I need more fuel to keep going. This lack of oxygen, known as ischemia, usually occurs due to the narrowed coronary arteries. These arteries are like pathways that deliver blood to the heart muscle. When they narrow, often due to plaque buildup, blood flow is restricted. This restriction becomes a problem when your heart needs more oxygen, like during physical activity or emotional stress. Angina is not a heart attack, but it's a serious condition that shouldn't be ignored. It's your body's way of telling you something is wrong. Recognizing the symptoms and seeking prompt medical attention is crucial for preventing further heart problems. Decoding the language of pain, types of angina. Just like there are different dialects of a language, angina also presents itself in various forms. Understanding these different types is crucial for effective diagnosis and treatment. Let's delve into the four main types of angina.
Stable angina. This is the most common type. It typically occurs during exertion and subsides with rest or medication. It's often predictable, meaning you might experience it during similar activities.
Unstable angina. This type is unpredictable and dangerous. It can occur at rest, with increasing frequency, or with less exertion than usual. It's a warning sign of a possible heart attack.
Variant angina, also known as Prinzmetal's angina. This rare type occurs due to coronary artery spasms, temporarily constricting blood flow. It often happens at rest and typically in the early morning hours.
Microvascular angina. This type affects the smaller blood vessels supplying the heart. It can cause chest pain, often lasting longer than other types, and may not be relieved by typical angina medications.
Knowing the differences between these types helps doctors determine the underlying cause. This knowledge is essential for tailoring treatment plans to address the specific type of angina and its triggers. The oxygen equation. Understanding the root of the problem. To grasp angina fully, we need to understand the delicate balance between oxygen supply and demand in the heart. Think of it like a car engine. It needs a constant supply of fuel and oxygen to run smoothly. Similarly, your heart needs a continuous flow of oxygen-rich blood to function properly. The coronary arteries are like the fuel lines of the heart, delivering this vital oxygen. When these arteries become narrowed or blocked, the blood supply decreases, disrupting the oxygen balance. When the demand for oxygen exceeds the supply, the heart muscle becomes starved of oxygen, leading to ischemia and the pain of angina. Factors that increase oxygen demand, like physical exertion, emotional stress, or even cold weather, can trigger angina. Conversely, factors that improve blood flow, like rest or medications that dilate the coronary arteries, can alleviate the symptoms. A closer look at mechanisms behind different angina types. Each type of angina has a unique mechanism contributing to the imbalance between oxygen supply and demand. Understanding these mechanisms provides further insight into their triggers and treatment.
Stable angina plaque buildup in the coronary arteries narrows the passage, restricting blood flow. During exertion, the heart demands more oxygen, but the narrowed arteries can't meet the increased demand, leading to angina.
Unstable angina. This type often results from a ruptured plaque in the coronary artery. This rupture can lead to a blood clot formation, further obstructing blood flow and causing unpredictable and potentially severe angina.
Variant angina. This type is characterized by sudden spasms in the coronary arteries, temporarily constricting blood flow. These spasms are often triggered by cold weather, stress, or smoking, and their cause is not always fully understood.
Microvascular angina. In this type, the smaller blood vessels in the heart muscle are affected. They may not dilate properly, limiting blood flow to the heart, even if the larger coronary arteries are not significantly blocked.
By understanding these mechanisms, doctors can develop targeted treatment strategies for each type of angina. This knowledge is crucial for managing symptoms effectively and preventing complications. Section 5. Fighting back anti-ischemic drugs and how they work. Medications play a crucial role in managing angina by improving blood flow to the heart muscle and reducing its workload. These medications, known as anti-ischemic drugs, work through different mechanisms to restore the balance between oxygen supply and demand. Nitrates. These medications, like nitroglycerin, are often the first line of defense against angina. They widen blood vessels, improving blood flow and reducing the heart's workload. Beta blockers. These medications slow down the heart rate and reduce blood pressure, decreasing the heart's demand for oxygen. This effect helps prevent angina episodes, especially during exertion. Calcium channel blockers. These medications prevent calcium from entering the heart muscle cells, relaxing and widening blood vessels, improving blood flow and reducing the heart's workload. Ranolazine. This medication works differently by altering the way the heart muscle uses energy, reducing its oxygen requirement and preventing angina. Doctors choose the most appropriate medications based on the type of angina, its severity, and the individual's overall health. These medications aim to relieve symptoms, prevent future episodes, and improve quality of life. Section 6. Beyond pills, lifestyle changes for a healthier heart. While medications are essential for managing angina, lifestyle modifications are equally crucial for long-term heart health. These changes not only complement medication but also address the underlying causes of angina, promoting overall well-being. Quit smoking. Smoking damages blood vessels and increases the risk of heart disease. Quitting is the single most important step to improve heart health and reduce angina symptoms. Healthy diet. A balanced diet low in saturated and trans fats, cholesterol and salt can help lower blood pressure, improve cholesterol levels and prevent further plaque buildup in the arteries. Regular exercise. Regular physical activity strengthens the heart muscle, improves blood flow and helps manage weight, reducing the risk of angina and other heart problems. Stress management. Stress can trigger angina episodes. Finding healthy ways to manage stress, such as meditation, yoga, or spending time in nature, can positively impact heart health. By embracing these lifestyle changes, individuals can actively participate in their heart health journey, improving their quality of life and reducing their risk of future cardiac events. Section 7. Putting it all together. Treatment strategies for angina. Treating angina effectively involves a multifaceted approach that combines medications, lifestyle modifications, and in some cases, procedures or surgery. The treatment plan is tailored to each individual's specific needs, considering the type and severity of angina, overall health, and personal preferences. The primary goals of angina treatment are relieve symptoms. Medications like nitrates provide immediate relief from angina pain. Reduce frequency and severity of episodes. Long-term medications like beta blockers and calcium channel blockers help prevent angina episodes, slow or stop the progression of coronary artery disease. Lifestyle modifications and medications aim to prevent further plaque buildup and reduce the risk of complications. Improve quality of life. By managing symptoms effectively, individuals can engage in daily activities without limitations, improving their overall well-being. The treatment journey requires ongoing collaboration between the individual and their healthcare provider. Regular checkups, medication adjustments, and open communication are crucial for achieving optimal outcomes. Section 8. Surgical interventions when medications aren't enough. While medications and lifestyle changes are often effective in managing angina, some cases may require more invasive interventions to improve blood flow to the heart muscle. These procedures aim to either open up blocked arteries or create new pathways for blood to bypass blockages. Angioplasty and stenting. This minimally invasive procedure involves threading a catheter with a balloon to the site of the blockage. The balloon is inflated to open up the artery, and a stent, a small mesh tube, is often implanted to keep the artery open. Coronary artery bypass grafting or CABGI. This surgery involves taking a healthy blood vessel from another part of the body and grafting it to bypass the blocked portion of the coronary artery, restoring blood flow to the heart muscle. The decision to recommend surgery depends on various factors, including the severity of blockages, the individual's overall health, and their response to medication and lifestyle modifications. Section 9. Angina and your future importance of long-term management. Angina, even when well controlled, is a chronic condition that requires ongoing management. It's essential to understand that treatment doesn't cure coronary artery disease, but it significantly reduces the risk of complications and improves long-term outcomes. Long-term management involves medication adherence. Taking medications as prescribed is crucial for their effectiveness in preventing angina episodes and slowing disease progression. Lifestyle modifications. Maintaining a heart-healthy lifestyle through diet, exercise, stress management, and smoking cessation is essential for long-term success. Regular monitoring. Regular checkups with the healthcare provider allow for monitoring disease progression, adjusting medications, and addressing any concerns. By actively participating in their long-term management plan, individuals with angina can live full and active lives while minimizing their risk of heart attacks and other complications. Section 10. Living well with angina. A journey of knowledge and care. Living with angina is a journey that requires knowledge, self-care, and a strong partnership with healthcare providers. While the diagnosis may initially bring uncertainty, understanding the condition empowers individuals to take control of their health. Remember, you are not alone. Many people live healthy lives with angina. Support groups and online communities can provide valuable information and emotional support. Asterisk knowledge is power. Understanding your condition, its triggers and treatment options allows you to make informed decisions about your health. Asterisk self-care is key. Adopting a heart-healthy lifestyle and taking medications as prescribed are crucial for managing angina effectively. By embracing a proactive approach to managing angina, individuals can live full and meaningful lives, prioritizing their heart health and overall well-being.